Hello everyone, it's Rochelle Grossman, and today we are at the Nepenthe Wellness Center located in Cedar Park, Texas, and I am joined by anesthesiologist Dr. Trevor Peck, one of the co-founders, and we're going to educate you a little bit today. We're going to tell you about ketamine therapy and IV vitamin drip therapy, just two of the services that are offered here at Nepenthe. Dr. Peck, thanks for joining us.
Thanks for having me.
Pretty amazing and cutting-edge treatments that you offer here in Texas. Let's start with ketamine. So for people that maybe have heard of ketamine in a negative connotation in the past, the clinical applications here can be really life-changing for certain people. People that are depressed, maybe have some chronic pain issues. So how would you describe what is ketamine therapy?
So ketamine is a remarkable new treatment that has a high success rate for treating a variety of mental health conditions and chronic pains. Uniquely, it's an NMDA receptor antagonist. Once it binds to this receptor on the membrane, it really enhances and boosts neural activity. By boosting and enhancing neural activity, ketamine helps the brain operate normally.
Okay, so a lot of, he's an anesthesiologist, right? So neural activity. So I'm hearing, correct me if I'm wrong, this drug administered safely and medically supervised can help the brain rewire itself so patients that maybe have lost hope can feel better and well again.
Precisely.
Okay, so you mentioned the chronic pain conditions. I was doing a little research, other treatments that I found, people that maybe have been chronically addicted to drugs, but cannot seem to get clean, or people that have had PTSD that no other treatment just seems to resolve. These are conditions that are pretty severe, and that I would imagine with a success story to get your life back to normal, the results can be amazing.
Absolutely. PTSD, anxiety, depression, fibromyalgia, chronic pain, arthritis, substance abuse, these are all conditions that people can benefit from ketamine treatment.
Alrighty, so how is it administered? So what is the treatment protocol here?
Well, typically after a patient completes an intake form as well as a mental health assessment, they'll come in for a series of 6 treatments over 2 to 3 weeks. These treatments are introduced through an IV. The patient comes in, we provide them with a private treatment room that has a comfortable recliner, flat screen TVs that we typically play nature videos on. We have noise canceling headphones that we play ambient music, anything to help them relax and feel comfortable in our clinic setting. We provide pillows, blankets, and sleep masks, and each appointment lasts usually about 90 minutes.
Okay, so what I'm hearing is it's administered right now via IV, comfortable treatment rooms. They're relaxed with the noise canceling headphones, about 6 treatments, and then when do people start to experience good results?
So typically after the first treatment, patients will notice a lessening of whatever symptoms they were having. For best results after the 2 to 3 weeks of 6 treatments, we typically recommend maintenance therapy between every 4 to 8 weeks, or as needed in between.
Okay, so if you're out there and you're like, ketamine, isn't that like a club drug? I've heard that name before. You've got to ask, do patients as they're receiving the treatment also experience that high?
Occasionally that euphoria or buzz does happen. Most of our patients typically feel deeply relaxed for the first time in years. Some even fall asleep, which is okay. You don't have to be an active participant because your brain's still getting the saturation that it needs. Ketamine promotes lucid dreaming or spiritual insights, and that can provide valuable experiences for overcoming trauma.
Are there any side effects, right? What are the risks here?
In the clinical setting, there's no long-term side effects. Only concerns we really have are people that have untreated hypertension.
High blood pressure, aka high blood pressure,
right,
for those out there. So because of what the drug does to the body, if you have high blood pressure, again, not potentially the best solution for you unless maybe you're being treated for hypertension and it's under control?
Correct.
Okay. Success stories. I'm guessing you have a bunch of success stories. Can you share one?
We have many. One of our favorite patients, she has suffered from chronic PTSD, anxiety, depression for the majority of her adult life. It's gotten to the point where she gave up on driving just because of extreme fear of being on the roads, and she basically became a recluse. After her 6 sessions, she reported over 80% reduction in her symptoms. She's now driving again, and she even ventured onto I-35 last week.
I-35? Nobody likes to go on. If you live in Texas, it's, yeah. But that's amazing.
Mm-hmm.
So we're really talking about somebody that was homebound because of the PTSD, the anxiety, and through this experience, now is it really able to live life again, including driving even on the awful I-35?
Absolutely.
Any long-term consequences, because again, you think about it as a club drug. So far, anybody have any just negative side effects?
No long-term consequences at this point.
Okay, all right. So maybe out there, fibromyalgia, chronic pain, if you have depression that has been resistant to other treatments, potentially this is an option for you. Okay, the next thing that you offer, IV vitamin drip therapy, IV, administered intravenously. I have friends that have had this post-hangover, you see. I've had it, or had hangover. That's not true. I definitely had a hangover. But they've said it really is remarkable, because when you have a hangover, you feel awful, right?
Mm-hmm.
How does it help?
Well, as is, most of our patients that are on antidepressants are already micronutrient deficient because of the medication. In addition to that, the IV drips can be great for mental clarity, heart and brain health, digestive issues, immune systems, hangover, skin brilliance, and weight loss.
I'm sure they're dehydrated too, right?
Exactly.
So when you have this infusion of vitamins, it just helps you look and feel better. You mentioned one thing, like certain medications cause nutrient deficiency.
Mm-hmm.
So this would be also a treatment for somebody that may be on multiple medications, and it's just really depleting your body of the nutrients it needs to feel good.
Absolutely.
Okay, I want to talk about some of the benefits there. So it boosts your immune system, I think I heard you say. Is it skin?
Mm-hmm.
Skin brilliance helps as well?
It does.
Okay. Feel better? Is there anything I'm missing?
Skin brilliance. We have a weight loss concoction.
Hangover, weight loss sounds like
Yeah.
a miracle cure.
Yeah.
I'll be booking my appointment shortly. I love it though. So between the two treatments and there's a whole other host of services here offered at Nepenthe. The bottom line is we really just want to restore hope to people that maybe have felt hopeless in terms of how they're feeling, and offer wellness solutions for the general public that's here in a comfortable, medically supervised.
That's our goal.
That's it. All right. Well, Dr. Peck, thanks for taking the time today.
Thanks for having me, Rochelle.
I appreciate you. And we want to let folks know where Nepenthe is. Again, it's located in Cedar Park, Texas. I'm going to give you the exact street address. It's 1210 Cottonwood Creek Trail, Suite 410. And I'm going to shout out the phone number. It's 512-986-7723. You can find them on Facebook, Instagram, all the social media sites, and of course, good old-fashioned Google, Nepenthe Wellness Center, and you can learn more or book an appointment. Thank you again, Dr. Peck.
Thank you.
All right, and we'll see you next time.